Hi, I'm Dr. Zac Watkins, and welcome back. Today what we're going to do is continue what we first started talking about, which is adrenal fatigue. What does adrenal fatigue mean? So if you haven't had a chance yet, first of all, I would suggest you go back and watch the first video talking about stage 1 adrenal fatigue of the 3 stages. And to reiterate, again, just a quick way to explain things is when we're talking about cortisol and the effects it has on our health, picture that we have this scale in for our body, and the more of these stressors we put on one side of a scale, the deeper and the more pronounced the scale drops. And basically, kind of like our bodies, that our scale gets more and more tipped to one side. And what happens is that we start to get this adrenal response where excess cortisol is released, and the more that cortisol is released, that's what can be damaging to our health. Now again, that cortisol response is a normal response, and we want that response. The problem lies where we keep stacking onto that scale, and the scale just doesn't go anywhere. And what happens now, that excess release of cortisol starts to become damaging. I touched on the first video a little bit that cortisol is actually a brain hormone, and when we have excess cortisol produced long term, our brain perceives that as our new normal, if you will. So the scale tipping, your body, your brain perceives this as your normal and has to respond in a way that that's conducive to excess cortisol. So your body thinks that this excess stress hormone output is normal, and the problem with that is it does inhibit part of the brain that actually then talks to our thyroid, to sex endocrine glands and things like that. So it's not common for those of you who have thyroid problems, hypothyroid, autoimmunity, things like that, that a lot of times it may not be the thyroid that's at the problem. A lot of times it could be this excess long-term cortisol release that's inhibiting the brain and telling the thyroid to work properly. So again, this is not a diagnosable disease per se that your medical provider would probably point out to you based off conventional labs. We use functional medicine labs that are looking at your individual physiology and the response that your body is doing and what we can do about it with natural methods to help tip your scale the other way, if you will. So we left off where we were in this stage 1 adrenal response. Our scale was tipping to one side. And what happens is, like a car whose gas is stuck to the floor, basically, whose gas pedal is stuck to the floor, you start to run out of gas. And that output starts to drop. So now that revving up and that complete output is now just slowly wearing thin. It's kind of like having a bucket and you have a small hole. Well, you'll still have water in it until the water starts to slowly leak and leak and leak until your bucket gets lower and lower. So what happens is, as this line continues, is this output continues to fall. It falls, and what I want you to see is that we now fall into this box right here. And this is important to understand because this middle section, remember, this right here is your normal output of cortisol. And we had a heightened response. Now we're dropping down again. So in a sense, we look like we're normal on the labs. You may see a lab report that says, oh, this person actually makes adequate stress hormone. But as you can see, you went through this phase or this stage of now dropping down. And the other way we know that you can be there is that we look at another stress hormone called Dhea. It's another stress hormone that's involved with testosterone production, and with women estrogen production. We're very kind of important for that too. So we look at those numbers and correlate, well, is their Dhea levels or their other stress hormone level dropping too? Then that's an indication that this is where you're at in the box. You're not over here. You've kind of went through this phase, this stage, this cycle. So where you're at now is, let's see, I'm sorry, this is very sloppy. Stage 2. This stage 2 adrenal response is right here. And this to me is kind of like the middle of the road for people. Their physiological process is not burnt out. but it's on the way. Most of the time I'll see people on their lab reports where when I explain this, I basically will say, well, you're probably right here in this corner, meaning you're on the edge of the cliff, you haven't yet fallen off, but you are getting pretty close and it's not going to take a lot to do it. So stage 2, adrenal response. And again, this is important because the more that you have this stress hormone output, and then now you start to wear out or poop out, if you will, this stress response is now worsening or getting not as good or responsive as it was. And that's important because that leads to a lot of chronic problems. Symptoms start to develop like fatigue, even memory issues like memory fog, forgetfulness. Fatigue's the other one, like I said. I'll describe in another video, but starting GI problems. And what's really, really significant with women is female hormone problems, whether it be PMS symptoms or menopausal symptoms, infertility. What happens now, the hormone production is start to kind of fade out, and then what it does with women is it's starting to steal from your other hormones, mainly progesterone and estrogen. So now you're getting some female hormones involved because it's trying to prevent this from keep crashing as it is. So very, very important to remember if you have female hormone problems, probably not necessarily a hormone issue, but more of a stress response problem that's relaying to sex hormone problems as well. We see that all the time, and that's why in my office I always look at this adrenal hormone function and sex hormone function because they work together synergistically. To do one without the other doesn't give you the complete story, and we're always trying to get the complete story with our patients. So stage 1, stage 2, stay tuned. I'm going to describe stage 3 and why this is important with adrenal health and your health. So thanks for watching.